Hi, my name is Tori Bryant, and I'm going to speak about the role of a nurse practitioner. So, what is a nurse practitioner? A nurse practitioner is an advanced registered APRN that performs duties similar to that of a family doctor. General NPs are capable of examining the patients independently, prescribing medications, diagnosing illnesses, performing certain advanced level procedures, and more. An NP's responsibilities typically include taking patients' medical histories, assessing their current health status, diagnosing any issues, developing a personalized care strategy, coordinating care with other health professionals, treating acute chronic behavioral conditions through procedures and medications as necessary, and educating patients about preventative health or how to best manage ongoing issues. So, nurse practitioner educations. NPs in the U.S. have a long history of delivering primary care to patients. The role was first established in the 1960s to help children in need to have access to health care. The first NP program started at the University of Colorado in 1965. Since then, the NP role and scope of practice evolved, and NPs provide care across the continuum of the lifespan in a variety of healthcare settings. In some states, NPs even have full practice authority, meaning they can prescribe medicine and practice completely independently of a physician. However, the state-level regulations governing this workforce significantly vary from state to state. Across the country, nurse practitioners must have their RN licensure and obtain at least a Master's of Science degree in nursing to practice. APRNs must also pass a national certification exam in their specialty. They can continue their education by obtaining a doctorate in their practice, which is considered the highest level of training in their nursing practice. As healthcare systems globally are facing challenges of meeting the demand for growing primary care services due to the shortage of primary care physicians, effective utilization of NPs can help meet the growing demand for primary care services. So how does a nurse practitioner differ from a PA? Both PAs and NPs work as licensed healthcare workers alongside physicians. The difference is that NPs have to attend a graduate nursing programs and PAs have to attend a graduate program that is based on medical education. NPs have full practice authority in half of the states in the U.S., and PAs work independently with the physicians. PAs are more generalized in medicine, while NPs are capable of working in specialty tracks. An NP started out as a nurse and eventually obtained either a master's degree or doctorate in nursing practice. Some states allow them to work independently without physician supervision. Physician assistants often have some type of prior healthcare experience, but not often in nursing. They obtain a master's degree and always require physician supervision. At the government level, NPs often answer to the Board of Nursing in their state, while PAs answer to the Board of Medicine. So what's the difference between an NP versus a physician? We both know both professions provide quality care to patients and deliver patient care through patient medical histories, symptoms, diagnosis of health issues, and medication management and treatment. Physicians, however, provide complex patient diagnosis and specialty care. When an NP obtains a nursing degree, passes the NCLEX, obtains a graduate degree, and obtains a board-certified NP license, a doctor goes through more extensive training. A physician has to earn a bachelor's degree, take the MCAT, earn a doctor of medicine, pass the medical license exam, complete residency program, obtain a state licensure, and earn a board certification that's optional. Though both careers can specialize and subspecialize, the specialties for a physician are slightly different than that of an NP. So why not become a physician? There's multiple reasons that someone may not become a physician. There's work-life balance. Physicians also train using the medical model similar to PAs, which means they focus on testing, diagnosis, and treatment of the disease that the patient has. NPs train on the nursing model, which means they focus on testing, diagnosis, and treatment of the patient with the disease. While the outcomes of two models are similar, philosophically they are very different. As an NP, you will look at how the illness affects the quality of a patient's life. You'll focus on health promotion and restoration and consider how the individuals, patients, families, and communities react to the illness based on racial, ethnic, cultural beliefs. And nurses look to how treatment plan can be implemented in a way that values the individual and family preferences and beliefs. While physicians tend to look first at the pathology of the problem and then how to cure it. Looking for disruptions in the pathophysiology of the body, a physician focuses on the biological aspects of diagnosing and treating a disease. Also, as an NP, you can go directly into the specialty versus not, and continuing with the work-life balance. It's very independent of the person. I know my own personal experiences. I have worked with both NPs, PAs, and MDs prior to starting school and determining which school I wanted to apply to. I had my uh, I had a bachelor's in biology, so I was capable of going all three routes. And the reason why I decided to be an NP was based off of the idea that of the nursing model, and because I noticed that out of all of them, the NPs seem to be more relaxed and enjoying their job. I don't know if that has to, you know, is if that's an actual factor, but that's just my own reasoning. So that is the end of my slides. Thank you.